everybody. This is a podcast where real medical professionals discuss fake medical emergencies. That means that unless you were at Shaka when the walls fell, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi, everybody. I'm Jackson Vane.
I'm Johnny Kolasinski. You may remember me from such podcasts as, a Quantum Leap podcast. Ha! Got it.
Nope.
This is Hi Everybody, a Bad Medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works.
Yep.
You can find us on Twitter, Instagram, and Facebook at Hi Everybody MD, and on the World Wide Web at www.hieverybodymd.com.
You can also call us at 530-DOCTORB. What's the B stand for this week? A really bad cough, I guess?
I was going to go with B-list celebrities like Clay Aiken.
Yeah, there were some B-list celebrities in this episode that we're doing today.
What are we talking about this week, Dr. Jackson Vane?
So we're finally doing Scrubs this week.
Yes.
And I think we picked a very good episode considering all the stuff that's going on in the world today. So it's an episode called My Life in Four Cameras.
Right.
So it's season 4, episode 17 if you want to watch this one. And basically how it's set up is everyone, I think the couples are having their own little thing. One girl leaves and then JD sits down, watches TV, and just hears on the news, hey, there's 27 cases of E. coli recently. So if you're a big meat eater, be careful.
Mm-hmm.
And usually that's when shenanigans happens for all of us in the hospital. And even they admit that when the media reports something, everyone thinks they have it.
Yeah. And in classic Scrubs form, the rush on the hospital starts like Jurassic Park with the water shaking and ends with JD crowd surfing his way out the Sacred Heart doors.
Elliot did break the cardinal rule of an emergency department or hospital. It's like, oh, it's not that bad, right?
It's quiet, a little too
quiet. Yeah, it's okay. And the minute you say that, and I know it's superstitious and there's no scientific backing, but we're always taught never say it's slow, never say it's quiet. Because the minute you say that, the floodgates open and it's hell.
Mm-hmm.
And I think that's exactly what happened is just shenanigans ensues. Everyone just bum rushes the hospital, fills up the parking lot, fills up the walkway up to there, and everyone just sits in the hospital lobby. There's no ER lobby, which is the one thing I noticed about Sacred Heart. There is no ER.
They just seem to have kind of like I was watching Emergence recently, and one of the main characters is a doctor, and they have the general hospital where you go to the hospital and you're seen by the doctor who is cast on the show.
And there are ERs out there that are not manned by emergency doctors or even pediatric emergency doctors, where it could be manned by a family medicine doctor, and it's a small hospital in a tiny city. I know when I was a medical student, I would rotate through one hospital, worked in the ER, and it was just one family medicine doctor manning the entire ER itself.
But Sacred Heart is in Los Angeles.
Yes.
Los Angeles, to my knowledge, and I'm not a statistician, but my understanding is that there are many people in Los Angeles, and they have multiple hospitals.
I mean, they have 3 or 4 children's hospitals, in a 15-mile radius or something ridiculous like that too, if I remember correctly. There could be more. I just forgot. But yeah, it's just crazy how everyone just rushes there and just they're the doctors that do everything.
Now, Scrubs is supposed to be set in Los Angeles, right? They don't...
Unclear.
I feel like...
They never mention it.
Yeah.
They never mention where it's set. It could be Middle America or something like that, but they never make it sound like it's LA. Because if it was LA, they'd be having more actors or whatever show up to their...
I don't know why I always thought it was specifically Los Angeles.
Because you knew it was filmed in Los Angeles.
Because I knew it was filmed in Los Angeles. And this episode in front of a live studio audience.
Correct. And I think the reason why we picked this episode is, when this episode comes out, I'm sure America and the world are still in the throngs of coronavirus shenanigans. Yeah. And that has been a nightmare.
Yeah. How much can you talk about that?
I mean, I will say this, the hysteria about coronavirus is really out of proportion.
Mm-hmm.
For those of you that don't know what coronavirus is,
or you're listening to this in 2022.
Correct. So coronavirus, this is a special type of coronavirus. So coronavirus itself causes a common cold. It's one of like the most common types of common cold. The reason why they call it a coronavirus is if you look at the virus, it looks like a crown.
Okay.
Crown corona, or beer, I guess, if you want to think of it that way. But this special one it's coded 2019 nCoV, right? So 2019 novel coronavirus, and it's theorized that it came from animals first, and then it made the jump from animals to people. And this virus in itself is very, very contagious. And that's why everyone's freaking out about it, is how fast it's spreading. Not so much how fast it's killing people, at least at this point in time when we're doing this podcast, but just how rapidly it moves from person to person.
If you're a survivor of coronavirus listening to this in 2022 from your bunker, please give us a call at 1530-DOCTOR.
Yeah, we'd love to hear from you. But everyone freaks out because when we do tests for coronavirus, or in general viruses, like if you came to my ER, you've been sick for like 6 days, sometimes I might do a swab in your nose just to see what kind of virus you have, be it flu A, flu B, RSV, and then it goes through this whole breakdown of many, like 15 or 20 different viruses. At least this is my hospital. One of the viruses we test for is coronavirus, but
that's
not,
because it's the cold.
It's the cold, but it's not this new 2019 virus. So we'll get a lot of families coming in saying, hey, I watched on the news, I have these symptoms, I have coronavirus. And the symptoms that you're supposed to be looking out for are, what do you think?
Runny nose, fever, and coughing a lot.
Yeah, and sometimes shortness of breath. Welcome to winter.
Yeah.
Everyone has that. And the thing is, the scarier thing is not coronavirus, it's the flu. The flu's
deadly.
The flu is deadly, and both are deadly in their own ways. Like, both can cause you to have respiratory failure. The concern with coronavirus is it can cause you to get like a SARS-like illness, so like a severe acute respiratory syndrome, where you can have lung failure and then potentially need something called ECMO, which we've talked about before, to kind of keep you alive. It can also act kind of like just like MERS, which is a Middle Eastern respiratory syndrome, which also has similar profile.
I didn't know that that's what that stood for.
MERS? Yeah. I believe that's what it is.
Oh, but MERS and MRSA are two different things. MRSA is the
methicillin resistant.
Yeah, and that's the infection you would get in a hospital most likely. Yeah.
Well, to be fair, most of us have
MRSA hanging
now.
out.
Yeah, because the staph that it has on your skin, as a lot of it's resistant to penicillin in general. But it's kind of nice to know what the symptoms you're looking for. Unfortunately, these symptoms are really vague. And Dr. Cox, going back to this episode, he kind of makes a joke going, it's not E. coli unless it's firing out of both ends. And he makes a very nice gesture with it too, which I'm not going to lie, I have done that gesture at work.
Elliot later says that it is not everyone in the waiting room spoke English, and it's very embarrassing to try to mime diarrhea.
It's very hard to... And that kind of brings up another point. Like, it's kind of weird sending your doctors out into the waiting room to triage people.
That's something that I noticed on Scrubs in particular, but television medicine as a whole, is you see one doctor from the beginning to the end of your experience.
And it's really rare to have that. Like, doctors change shifts. Some hospitalists will work for a week straight and then are off for a week, but they might not be on your team every week. It's a lot of change through doctors, especially in an adult facility or a bigger hospital. There's like 8 or 9 teams going at any time.
Yeah, the patient in this episode, who's a writer from Cheers, goes from, hey, I'm coming to the lobby of the ER hospital, whatever Sacred Heart has, because of this E. coli scare, but then I'm diagnosed with lung cancer.
Yeah, it's weird because, kind of going back though, he was in the lobby, JD recognizes who he is and takes him to some room upstairs to do more tests, but not really do more tests, more just to talk to him. And as a person who has worked in a very busy emergency department and there's no rooms for me to see patients, sometimes they make me see patients in the waiting room. Like, I have to ask them, is it okay for me to examine you and ask your history in public? Because you might ask something that they don't want other people to hear.
Right.
Or...
like the sexual history.
Correct. Or you do something that I still regret doing to this day, and is seeing patients in their car, because then I'm just basically driving home the point of drive-through medicine.
Yeah, quite literally.
Never doing that again. That was one of the busier years in the emergency department. There was nowhere to see a patient, and the family did not want to get out of their car, so I saw them in their car.
Wow.
It was fine. They had a cold.
Were there fries?
No. I didn't have shakes. I could have brought them a popsicle, I guess. One family's like, where's our popsicle? I'm like, here's what you need to do. Go inside, finish your registration, and leave. You don't need to be here. But that one was nuts. But this dude, going back to the writer guy, he just started coughing randomly.
Mm-hmm.
And I'm like, why do you need a chest x-ray? That was surprising.
Yeah, he had a hacking cough.
Yeah. And I don't get chest x-rays on everyone who has a hacking cough. Like, I'll be the first to admit it. I think the only thing that maybe makes me go, like, fine, I'll get one just so I can sleep easier is because he coughed for quote-unquote months.
Mm-hmm.
But then he didn't get a chest x-ray. He got a CT scan as well. And chest x-ray is one thing, but when you go through the donut of truth, like, you know something's up. Like, as a patient, you have to consent to doing that. It's a very invasive procedure. It's a lot of radiation. You increase the risk of cancer, which, haha, spoiler alert.
Yeah, he gets it.
But they did all that stuff, and you would expect them to have more symptoms than just a cough for having metastatic cancer. As a person who would have metastatic cancer, he should have weight loss, right? And he definitely did not look like a gentleman who had weight loss. Yeah. He'd be complaining of other symptoms too, like maybe chest pain, maybe coughing up blood, especially looking at the CT scan he had. Mm-hmm. That's pushing on air cells, and those air cells are probably compromised, and any amount of pressure probably would pop a blood vessel, and he'd be coughing up a lot of blood in that point too.
He wouldn't have been asymptomatic and then died within 12 hours.
Unsure if he was dead.
True.
He was in a bad shape. Because after the fantasy and stuff like that, he drops and just allegedly goes apneic. But there's no monitors or anything on there. So the only way they would have caught him going apneic was someone was luckily there.
So this episode is divided into the sitcom fantasy and the real quote real world of Scrubs.
Yeah.
Were there no monitors in the real world either?
So if you remember, after they took the X-ray and the CT scan, they put him in a room. He didn't have anything on him at all. He was just in a quiet room. But to be fair, none of the private rooms in Scrubs have monitors at all. If they were in the ICU area, which it looks like he ended up in the ICU area later, they sometimes have monitors, but he was not on a single monitor during that whole time. He was also not on any fluids or anything like that. But Elliot, for some reason, was there and realized that he went apneic. Mm-hmm. And he goes, wanted to call for anesthesia, but right when she said that, she put a bag right on his face to start helping him breathe, which is the right step to do. It might have been easier for her to lie him flat to do it, because if you think about it this way, if you're sitting up and trying to put something on someone's face while manipulating a bag at the same time, it's really hard.
Yeah.
If they're slippery or you're slippery, you're not going to be able to hold it up and get a good seal.
Yeah.
It's easier to lie him down so that way you can push the mask or lift his face up into the mask. I shouldn't say push the mask into the face. That's bad in poor form. But you can lift their face into the mask and actually do proper ventilation and then potentially go into CPR if you need to. But she also called for a tube to intubate him and all that stuff.
And what I noticed in that was that JD just walked away.
Yeah. It's the old not my problem kind of thing, which is, I will say this, if you're not like into critical care and all that stuff, you might kind of take a step back, but you wouldn't walk away.
Wouldn't leave the room, especially with there only being two people in the room other than the patient.
Correct. It's always the do you need help situation. And that's like a big thing. And I've been guilty of walking by a code and they go, do you need help? And they're like, yeah. I'm like, okay. And I jump in and do all this stuff. But it's also crazy that this is his quote unquote hero.
Yeah.
And he goes,
and his patient.
Yeah. And they're like, oh, you're dead. Or it's like, my shift's over. I'm leaving. But Elliot and him started at the same time. Right? So technically, they both are either on shift at the same time or Elliot is being a good person and staying after her shift. Sometimes you have to stay after your shift, even if you don't want to.
Yeah. I'm guessing that an E. coli scare would get this kind of rush in the same way you're probably seeing right now with
Think
with
about
the
this.
Wuhan.
Remember Chipotle?
Yep.
Yeah. So
I was gonna go with the romaine lettuce.
Romaine lettuce, Chipotle scare. When that happened, a lot of people came in and were like, "Oh, I ate Chipotle. My stomach hurts." I'm like, okay.
Did you eat Chipotle?
No, and they'll be like, "Yeah."
Well, there's your problem.
There's your problem. Like, well, I want antibiotics. And the thing with E. coli is, there really isn't a treatment for it, unless it's like really bloody poop, and then you have this special type of E. coli that causes a toxin to come out, and then can cause your kidneys to shut down. It's a really rare one, but even the management for that is, fluids, sometimes fluid restriction, monitoring your kidney functions, dialysis even. So
no poop transplants.
No poop transplants.
It's not C. diff.
Correct. But people will come in, if you heard something on the TV that's scary, you will come into the ER. But the crazier part is the flu, still scary, but everyone ignores it. Or says they get the sniffles and then they come in with they're panicking thinking they have the flu and they're going to die.
I feel like, and maybe this is just me and my family or some weird thing about Toledo, Ohio or whatever, I always associated the flu as being a gastrointestinal thing and not a
So here's the thing.
respiratory thing.
So the flu is not just a respiratory thing or not just a GI thing. It's both. It basically hits your whole body. As someone in my fellowship described it, he said it's like getting hit by a bus. Everything is affected. You're going to get a headache. You're going to get body aches. You get fever, cough, runny nose. You're going to have vomiting, diarrhea. Basically, if that system can be affected, it's probably going to get affected. Like, you'll have some kids that have such bad muscle pain because their muscles are breaking down a little bit and actually causing them to clog up their kidneys, and then they need to be admitted for hydration so they can pee out all this stuff. They get like Coca-Cola colored urine. Yep, I ruined Coke for people, and that's okay. Kind of going back to the CT scan and chest x-ray stuff, with coronavirus, you actually get ground glass opacities, which can also be seen if you had cancer. So it's like a finding on a CT
ground
scan.
Glass opacity.
So it looks like if you took glass and you ground it up, that's what it kind of looks like on your chest x-ray, and that can actually be one of the signs of cancer too.
Oh, lovely.
So I actually
this is with the Wuhan specific.
The Wuhan specific, yeah. Yeah. So like,
is it Wuhan or Wuhan?
I don't know.
Yeah, okay.
Wu-Tang. The Wu-Tang coronavirus. God, that's a quote for the episode, isn't it? But this is why I don't read Facebook as much anymore. I'm trying to just cold turkey it. Is now people are scaring other people in the comments section saying ground glass opacities on CT scan means that you have Wuhan virus, which causes lung cancer. So these are minimally educated people to medical stuff, scaring the crap out of very impressionable people. I don't like the term fake news, but this crap is fake news. They just scared everybody and made them really, really panic that now there's a concern that Wuhan coronavirus is causing cancer.
Right.
Which is not true. Yeah. Do not quote me on that part.
That's the title of the episode.
What?
Wuhan causes cancer.
Don't you dare. I don't want this podcast to be associated with that garbage. That would be like goop level stuff, which I know we're gonna touch on goop at some point, and I'm gonna cry.
Yeah, I'm looking for. We need a dedicated weekend where we don't like our livers to watch through goop.
You mean we need a lot of
goop lab?
We need a lot of podcast.
A lot of podcast
to get
juice.
Through that one.
Scrubs, however, remarkably get throughable.
Oh, I think I mentioned before we taped this episode, I can watch this all day, and I'll probably fall into a Scrubs hole.
I might also fall into a Scrubs hole. Yeah. We might be texting back and forth about what episodes we're doing next.
Because this is, you ask any medical professional that watches a lot of TV or not even that much TV, and they will hands down tell you Scrubs is probably the most accurate of all medical shows. It's very similar to what we go through, the hierarchy, the sarcasm of certain professionals, and just the collegiality of the people, the relationship between nurses and doctors, not romantic, but definitely you're all on a team. No one's belittled. I think that's the big thing you notice is no one's really belittled except during rounds, I guess.
Yeah.
But no one's ever put down and told that they suck or anything like that. Like they
Except for by Kelso
or Cox.
Kelso and Cox.
Both of them put down their residents equally.
Mm-hmm.
A lot. Which, you know...
Are you the Cox of your hospital?
I don't know.
No?
I don't think I am, but I'm sure the people listening who work with me might argue differently. But I don't believe I am. But who knows?
Would there... So, the side plot of this episode is Clay Aiken is working in the cafeteria, and Kelso needs to cut $30,000 from the budget, and hands it off to Cox.
Yeah.
Is that the sort of thing? Like, how much poetic license is taken there?
That's a lot in general, because the chief of medicine doesn't always...
Is not the CEO of the hospital.
Or CFO for that matter.
CFO.
Yeah, they're not usually dealing with that stuff, you know? They're dealing with making sure that there's best practices in medicine, making sure the hospital is running efficiently, med staff that needs to be there, you know, basically making sure the ship runs well medically, not financially as much. At least that's from my limited knowledge of what a CMO does, or the chief of medicine does. Because CMO is different from chief. That's the chief medical officer.
Right.
Then each division has their own chief too. So on his thing it says Department of Internal Medicine, Chief of Medicine.
Cox's?
Kelso's. So he's only really the chief of his department.
Right.
He's not the chief of...
How much external medicine is there, though? In dermatology?
Well, there was the joke in Sacred Heart. There was... I think it was on the episode before this one, when they were all quarantined. It was like a dermatologist running around yelling, "Dermatologist on call," and freaking out and all that stuff. So dermatology exists. Radiology definitely exists.
Radiology would not be under internal medicine?
No, that's its own specialty. And I remember the radiologist came in and got mad about using... He threw a temper tantrum about his machine, and I'll never forget that one. It's really, really good. But that's its own specialty as well. Department of Surgery. Turk later becomes the chief of surgery. So that's different department.
See, I think of all of this as me, again, showing my non-medical background. I think of all of that as internal medicine, because it's inside of me.
But internal medicine is a broad term, meaning basically just adult medicine.
Yeah.
That's really what it is.
As opposed to family medicine, which would be adults and children.
Yeah, so think of that like the jack of all trades. You have knowledge, a little bit of knowledge about everything that you can use to kind of take care of the family, but you know if you need to transfer or ask for a referral, you can send them out. So like Greg was trained in family medicine, but then he did a specialty in palliative care.
Right.
So that's in a different way too. So, but in this hospital, there's at least a few specialties. Never really a pediatric person in there. They've never mentioned a pediatrician once. I know they mentioned an OB-GYN because Jordan, Cox's wife, likes him because he's dreamy.
And wasn't...
There's a urologist too.
Yeah.
Which is Elizabeth Banks.
Yeah. Yeah, she was a urologist.
Yep. I can keep going. I know way too much about this.
Obviously, there's the Todd.
The Todd is surgery.
Todd is surgery.
Who works under, what's his face? Turk.
Yeah, eventually.
Yes.
And I forget whether Hooch
is a surgeon.
Hooch is a surgeon.
Hooch is crazy.
Yeah. Was Turner also? Or do we not see Turner anymore?
Turner was a partner of his, yeah.
Okay. Hooch is crazy.
Hooch is crazy. But yeah, good episode. I think it does tie into... I think the opening really does tie into what we're going through today.
What any other medical professionals that are listening to this right now.
It sucks. Oh, especially the poor ER doctors who get all your hypochondriacs and stuff like that show up a lot and get bombarded. Kind of like this. Like, our numbers this year, like, we get statistics on how many patients come to our ER per day. We have not gone down. If anything, we've gone up. And usually around this time of year, we'll level off. Or
because kids are going back to school. And...
Well, not so much that, but like maximum saturation of flu usually happens to the community, right?
Okay.
Like, once you hit a certain point, like everyone's sick and everyone knows, and they don't kind of go in that much anymore, and then it should start kind of tapering down. We haven't tapered.
No.
If anything, we're still going up, and the whole department feels it. And especially when you have a quarter of the patients coming in thinking that they have something that they don't.
When they might actually have coronavirus, but the coronavirus is the same coronavirus
that has always
that they've
been.
had for the past 50 years.
Correct. Who knows how long?
Except for probably not your patients. It'd be the past 15.
Yes. But that coronavirus, everyone gets confused when they hear that versus the one that's the novel one right now.
Now, are you seeing an influx of adult patients trying to come in?
I had a few adult patients show up. Usually they check in with their kids.
Okay.
So they're like, I'm already here.
Hey, well, I'm here.
Yeah, you want to check me out too?
Yeah.
I'm like, no, I don't want to check you out.
Not at all.
No, not at all. That is inappropriate for a doctor to be doing right now. But if you want me to evaluate you, you need to check in. So that's usually when we get the 3 furs or the 4 furs and stuff like that. And usually when the number of furs increase.
When you start getting into Costco packs.
Oh, God. My worst is still 7. It was fun. Obviously, they weren't that sick. They all had lice. That was a 7 fur.
Oh, well, I mean, that'd be obnoxious.
That's not an
But it's not surprising at all
not
that all
an,
7 of
not
them
an
had
emergency.
lice.
Not an emergency, though. That would be my argument.
Moving on, I have an important question.
Oh, God.
The human centipede bills itself as 100% medically accurate.
Okay.
If that's the case, how medically accurate is Scrubs season 4, episode 17, did we say?
Yep. My
life in 4 cameras.
Okay, so it is definitely more accurate.
Let's specifically the imaginary sitcom side of things.
I'm not even including that because that doesn't count. That's imaginary.
Right.
That in all intents and purposes doesn't exist because I'm never taking a patient hot air ballooning.
Not with that attitude.
Also, as JD said, it's a wicker basket propelled by fire. I am not going anywhere near that. I lived in Albuquerque for 3 years, never stepped into a hot air balloon once, and I still will never.
Is that a big thing in Albuquerque?
Yeah,
or is that just how you get around?
It's the balloon fiesta. It's the International Balloon Fiesta. Balloons land in people's backyards. No joke. That actually happens during Balloon Fiesta.
One of my mom's good friends was a hot air balloonist.
You mean
Balloonier?
a pilot?
Pilot, yeah.
Hot air balloon pilot. That's what they like to be referred to as. But I will say that this episode is more accurate. I mean, it's probably... What did I say for House?
The House, that one was like 140, I think, was you and Courtney's consensus.
I think that's about right.
Or you and Greg's consensus.
I think that's still about right. You know, the only weird things are the ER and how they manage patients because A, there's no ER, and B, they take, you know, the way they triage patients and move them around. That's completely not accurate. But kind of portraying in a very, I guess, exaggerated way of how a hospital gets overrun when there's any kind of media hysteria. That's really, really true. And it's the bane of the existence of the emergency department at times because we are the front lines. So if there's any freak out, the first place to feel the pain is usually the emergency department. And then I think the whole managing when he was apneic, there's things that could be better, obviously, but that's all like medical style points. None of them are intensivists.
Yeah.
Elliot and JD are definitely not intensivists. They don't work in the ICU and manage patients like that. So they wouldn't know how to do it really clearly because they didn't know how to intubate the patient because they were calling for anesthesiology. But yeah, for the most part, I thought it was pretty good.
Tangent before we end the episode.
Okay.
You said that ERs are going to see the first brunt of things. What about urgent care?
So urgent cares do it too. And funny thing is when my wife and I, Laura, went to get shabu earlier today, it's right next to an urgent care. And there's a big sign on the urgent care before you can open the door that says, if you went to China or were exposed to a person from China, do not come into the urgent care. Go directly to the emergency department.
Did you take that sign down?
I really wanted to. But I understand why is if you went to an urgent care and you were potentially exposed, you're exposing everyone else in that urgent care.
Right. And
so,
that urgent care is not equipped to deal with.
Correct. That urgent care isn't. And it's also a private clinic. So they would have to close for days possibly and they'd lose a lot of business.
Yeah.
I remember when I used to work in an urgent care, and we had a measles scare, I had to close my department, call everybody in the department and patient at home and tell them, hey, you might have been exposed to measles. I mean, we already do that in the emergency department. Like, people should know. But if you came to my ER and you had a concern for exposure to Wuhan coronavirus, we'd actually put a mask on you and kick you out, make you stay outside, and then bring you into a room with isolation. So those rooms are specifically built so that they suck air in and never blow air out.
Man, that would be... We talked about that actually in the house episode.
Yeah.
That would be so freaky. I go to the ER and they say, no, we think you're too sick. Wait outside.
Some people want to wait outside, but we do send people outside and make them put on a mask and wait outside for a little bit, or wait in their own car. And then we'll call them when we're ready, and then they can come in. But, yeah, it's... So urgent cares, some of them are not willing to see those patients. I'm not even saying well-equipped to see them. They're not willing to because the risk is too high for their financial stuff, too, and they might not be able to equip to handle.
And for their doctors and patients because they're not equipped to.
I mean, really, what you need to do is wear a mask and wash your hands. Yeah. Plus, come on. It's not that bad yet. It's... Right. People were saying it's the next plague to kill everybody, and that it's the sign of end times. And then the other conspiracy theory I saw on Facebook, which actually is why I deleted Facebook and all that stuff today, was that it was made by the rich oligarchy to kill us in population control. And I said, that's enough. I'm out. Thanks. Goodbye.
All right.
Goodbye forever. So yeah. As I'm gonna get probably killed by the Illuminati for...
Yeah, there goes our Illuminati sponsorship. Oh, God.
Now no Casper mattresses from the Illuminati?
No.
Damn it.
No, you're going to be stuck with that purple mattress.
If I have to, that's fine.
Also no purple mattress sponsorship.
No, not with that attitude.
All right. So, yeah, with that, if Wuhan does end the world and you're listening to this in your secluded bunker, 10 Cloverfield Lane is really good and really speaks to what you're going through right now. If it doesn't end the world, then we'll be back next Tuesday to talk about more about what Hollywood gets right and wrong about medicine.
Yep. Thank you so much for listening.
Thanks, folks.